So there are strategic plans to improve the outcomes for people with rare bone diseases. And we're now entering a phase of a sequence of steps to achieve this. So there is a plan. I know for many people with OI, it's very confusing because it seems like everything's disorganized and uncoordinated, but actually we are getting there. So next slide. Let's touch on the European platform. This is something called the European Reference Network, which has been running for some years now, and the one for bone is called BOND. Next slide. And the whole model of the European Reference Network is based into three main areas. First of all, the expertise travels to the patient wherever they live. And this may be a healthcare professional giving a direct preparation, presentation, or an assessment of the patient. The second one is, I think, the key one. This is where the expertise travels to the local doctor. And this is already happening within the ERN and is working reasonably well. So if you have your local doctor can't fix for getting advice level. And there is a fantastic been in the field for 40 years who've seen pretty much everything, and they give such good advice that's not available in any textbook or anything like that. And finally, where there is a very specialized procedure, maybe an operation or a special diagnostic test, there's a system for the patient to travel to the center of expertise. We call patient travels to the expert. So how do you deliver all of this? Next slide. Well, you can find out more by visiting the ERN Bond website, which has got so much information. In fact, it's got all the information you need to learn more about the Bond website and how it works. And a key reason why we support this is that we've got fantastic EPAGs, or patient advisors, and these are people with rare disease who've made sure everyone who works in Bond stays focused on the benefits for patients. And I think I saw Rebecca on the list, and Ines is our other EPAG member, and they've been so helpful in keeping us on track and making sure we deliver. Next slide. And these are all the hospitals that are involved with the Bond, and you can see at the moment, before we Brexit, we're still blue, we're still within the network, and that's something that we're very proud of, and we've actually contributed a lot to how the Europeans have set up their systems. Next slide. So this is a complicated slide. You can go through at your leisure, but it basically shows how the Bond ERN works. And they've broken up the system into different pathways. So, for example, how to get diagnosed on the top left is led by someone from the UK, Meena Balasubramanian, and she's done a lot of work on the diagnostic challenge. We've got a section on research and clinical trials which Nick Bishop helps with, and I lead the natural history of diseases and how to promote sort of epidemiology research. But there's also sections on multidisciplinary care, education and training, and how we work with other ERNs. Next slide. And this is a system that we're using to talk to other European doctors. It's called CPMS, and if your doctor doesn't know what's going on and they're in one of our ERN hospital sites, they can then ask you to fill in a very simple consent form. You literally have to fill it in. It's a tick box, very simple. It's not a long consent form. And once that's done, your doctor will then spend the time to upload your clinical data to a secure website and then invite experts around the whole of Europe to contribute to a discussion about whether you need more tests, what's the diagnosis, or what are the treatment options that should be discussed with you. It was very fiddly to start with, but now it's working really well. In fact, we're working with our partners at the endocrine ERN, Endo ERN, because many of our bone disorders have hormone problems as well. Next slide. And this is what it looks like when I log on. This shows each person is called a panel, and you can see there's an urgent panel waiting that was uploaded on the on the 20th of August, and there are other panels that I'm contributing to. And it's a really nice discussion. Often there's nothing you can add because there are very experts on the panel, but there's always some aspect that you can sometimes contribute on, and it's also a great learning experience. Next slide. Building this platform, we realized actually there was a need to really understand how people with rare bone diseases from birth all the way through their life course face diagnostic challenges, challenges around complications, treatment and monitoring. And to address this, Natasha Appelman from Leiden University in the Netherlands has put together a fantastic program called Your Bone, no pun intended, and this will set up a platform where doctors and patients can record their experience of living with the disease with the aim of getting better diagnostic tests, better assessment platforms, and better treatments. Next slide. And Your Bone is actually a very nicely designed study. We have the management team in WP1, and that's Work Package 1, and then we have a dissemination and access team, and then an evaluation quality assessment team. And these oversee three main packages. One package is looking at what doctor-reported outcomes we need to collect. One is looking at what the sort of database should look like, and one is looking at the patient outcomes. And this is the one that I lead, well, I co-lead really. Ines and Rebecca do most of the work. They're our patient representatives. And that aim is to build a patient platform that permits patients to access and also add data that will help us understand the natural history of rare diseases. And we're focusing on 4 groups or clusters of rare diseases: fibrous dysplasia, McCune-Albright syndrome, osteogenesis imperfecta, rare hyperphosphatemic disorders like XLH, and achondroplasia. So that's a really exciting study. It's already started. We're about 9 months in, I think, and we're already producing good results. Next slide. Of course, the B words there, I just left that in as a sort of reminder. We're not quite sure what's going to happen in January, but the Your Bone study will continue, but our ERN participation may change. Next slide. So in the last 5 minutes, what is happening to our NHS? It's often a question I ask myself. So our NHS, as you know, is split into 4 organisations: England, Scotland, Wales, and then Northern Ireland. And I will now tell you what's happening in NHS England, because that's what I know most about. Next slide. So the NHS England budget was around just over £100 billion a year, and it's gone up recently. And that money was divided into money for local hospitals and what we called clinical commissioning groups, or CCGs, and they help fund the hospitals. Money that goes straight to the GPs to help them run, and then a little bit, quite a lot of money going to what we call specialised services. And this is important for you to know as a person with osteogenesis imperfecta. Next slide. So specialized services deal with rare and complex conditions, and they're not available in every hospital. There are 149 of these specialized services at the moment, and they cover a range of issues like specialized cancer treatments, transplants, and specialized aspects of mental health. And if you go on the NHS website, there's a really nice video about what specialized services are. Next slide. And as Christine already mentioned, there's already what we call a highly specialized service for complex osteogenesis imperfecta for children. And the 4 centers are shown here, and the restriction there is only for up to 500 individuals are funded. And there are sort of mirror systems in Glasgow and in Belfast. Next slide. But then what happens to children without complex osteogenesis imperfecta and all the adults with OI? Well, at the moment, there's no service for them. So they have to go to their local hospitals and their GP practitioners who may not have the expertise to deal with specific aspects of their health. Next slide. But we have a plan. Next slide. And this is to develop a specification. So we now need to help the NHS understand what they need to provide. It should be evidence-based and be able to show that it's working and it's a good use of NHS money. So where are we on this plan? Next slide. So what we have to do now is each hospital has to fill in a form to show what do we have now already in the NHS. And the people at the NHS will then use this when they plan to see where the service gaps are and where they can improve. So we've been asked to look at how many people do we see across these broad groups that includes OI, what current services do we already have, next slide, and where are the gaps? And the gaps could be care gaps, like having a specialist practitioner, specialist therapists, access to psychology and pain, transition, as well as organizational aspects. You know, we have to have team meetings. Well, we have to have someone to organize that. Do we need a database? Do we need to have in our job plans time to improve our services, as well as training and research? Next slide. And then once they've done that, the NHS will then look at where the gaps are across the country and use this to define the specification. That will then look at the funding model we have in the NHS and what is fundable. And then we're thinking of putting together specialist networks. So it won't be hospitals, but it'll be clusters of hospitals grouped by where they are in the country to cover areas of people. And then a key thing is looking to see if it works. And this may involve surveying patients. Next slide. And you know, how can you help with this? Well, you have a really important role to play here. Through the BBS and other charities, including the Restricted Growth Association, which seems to be missing from the slide, but should be on it, there is a really important need to co-produce whatever we make for the NHS for your needs. And it's highly likely that each network will need a patient group that will advise on the service model, how people with rare bone diseases can navigate to different hospitals and different sites. I know that's come up, where's my nearest specialist centre? But really importantly, work with the healthcare professionals or HCPs to understand how well the current model is working and how to improve. And we will be doing this through our patient societies and patient groups. So if you're thinking, well, I've got the energy, I've got the enthusiasm, I really want to help improve my local or maybe regional service, log in, do connect with your local patient group and work and register your interest. So when they may come to you in the Northwest, the Northeast, or the Southeast and Southwest to say, we need patients who are interested to help us improve our services, those people are already there. Next slide. So in summary, there are care gaps across the life course of people with rare diseases. There are very good European plans to provide the evidence for better diagnosis and treatment, but also through the CMPS platform, a way of sharing this knowledge now. And there is an NHS plan for rare bone disease networks that goes above the complex OI service at the moment, but we will need your support as people living with these diseases and disorders and conditions so we can make sure what we make works best. It's just at 12 o'clock, so I'm going to stop and have a look at the questions.